Hello, today I'll be talking about the uses and explanation of an endotracheal tube. An endotracheal tube is a flexible plastic pipe that is made from PVC that is passed through the trachea via the mouth or the nose. The length of the endotracheal tube that is suitable for males are usually between 21 to 22 centimeters, while the length of the endotracheal tube that is suitable for females are 20 to 21 centimeters. It is very important to note the length of the tube while you're intubating the patient, as it may be required later on during the care of the patient. There are several parts of an endotracheal tube. The first part is the bevel. The bevel is at the tip of the endotracheal tube and it is slanted. It is usually left facing, and this is because it is easier to visualize the trachea and the vocal cords during intubation of the patient. The next part of an endotracheal tube is called the Murphy's eye. This is an opening that is located near the tip of the endotracheal tube, and it is usually used to sustain ventilation when the bevel has become obstructed or blocked by the secretions or the tracheal fluids of the patient. The next part of an endotracheal tube is called the cuff. Endotracheal tubes can be of two types, cuffed or uncuffed. The uncuffed version is normally used for pediatric patients since the cuff can damage their airways. The cuff is inflated by injecting pressurized air through a syringe into the pilot balloon. The pilot balloon remains outside the patient, and it is an indicator of whether the cuff is inflated, deflated, or if it's leaking air. An endotracheal tube is used for patients who require continuous mechanical ventilation as a way to connect the patient to the ventilator, or it can also be used to intubate patients to keep the airways open so that they can receive oxygen, medicine, or even anesthesia. Due to the position of the tube, since it is between the vocal cords, it is difficult or nearly impossible for the patient to speak. Hence, it is important for the nursing assistant to have nonverbal communication methods with the patient. For example, when you ask a patient a question, they can blink or move their fingers to let you know that they understood or if they have any questions. And that is the use and explanation of an endotracheal tube. Thank you.